Thanks, Concordia. I welcome this motion before us this evening. I think it's timely and it's about time. I think that, there was serious consideration given to the role that nurses play in this country generally, but particularly over the last 2 years. And it really is a shocking indictment that nurses have to take to the streets to come out to protest for what they have long been promised and for the recognition that they absolutely deserve. I welcome, Minister, your announcement that the booster is going to be extended to healthcare workers, and like others, I don't know why there was any delay in this. It was an obvious move, and of course they should be very much at the top of the queue. Because we know that apart from the fact that so many nurses put themselves in danger on a daily basis, that as a result of their contact with patients with COVID, around 3,500 healthcare workers are off due to COVID. And about 10% of those then will have long-term COVID, the effects of long COVID. The fact that the booster will be provided to them over the coming weeks will undoubtedly protect them and will also protect the capacity of the health service. However, I want to repeat that point that I made earlier, that vaccines alone will not protect nurses or healthcare workers generally. And, Minister, I really think that we're repeating the mistakes that were made over the past year, where all of the concentration was put on the vaccine programme. And it's fantastic that there was the breakthrough with vaccines. It's fantastic that there was that development. They were developed so quickly. And the rollout here was exceptionally good. But all of the emphasis was put on the vaccine programme. And other measures that could have been put in place much easier, or in addition to the vaccine programme, were more or less overlooked and neglected, I have to say. So, you look back at what's happened. We were late to adapt and adopt the recommendation for mask wearing. We have been late in relation to antigen testing. Antigen tests were recommended last March. It took a second expert group to recommend them 6 months later. And now we're only starting to use them in a very minor way when other countries have been using them for over a year on a widespread basis. We have been exceptionally late in recognising the fact that COVID is an airborne virus. And I cannot understand why the government have not acted on this. It's been known since summer of last year that COVID was an airborne virus. There were straightforward measures that could have been taken, which would substantially reduce the spread of COVID. And for some unknown reason, those measures were not taken. Now, we're at a point at this stage, facing into winter, with a complete underestimation of the impact of seasonal conditions on the virus. You've announced this evening 3,700 plus cases. That figure far exceeds the projections made by NEFIT under the most pessimistic scenario, and far earlier than NEFIT predicted any kind of numbers like that. They said that under a pessimistic scenario there'd be likely to be 2,500 to 3,000 cases per day during November. We're now at the 2nd of November and we have far exceeded that prediction. So the question then, Minister, has to be, what steps are going to be taken now to reverse those figures or even to contain them? Because I'm not hearing that from you. I'm not hearing it from NEFIT either, I have to say. And there are many practical measures that could be taken, particularly in relation to ventilation and the key role that good ventilation plays. And I cannot for the life of me understand why you're ignoring those. And this is practice that has been established as good practice in so many other countries. For a start, you have done the minimal amount in schools in terms of very, very late in the day providing CO2 monitors. You have refused to provide any kind of air purification systems. Equally in relation to hospitality, no requirement to have proper standards of ventilation. In most European countries now, there is a requirement in hospitality for them to display the reading from the CO2 monitor in the front window, so that the system is policed by the public and people can choose to go into unsafe circumstances or not. We also know that in relation to the workplace and people last month being advised to go back to work, in the complete absence of any kind of guidelines or limits being advised in relation to CO2 levels, how to measure it, how to ensure proper ventilation, what steps to take when the air is infected and is unsafe. I can't understand why you're not doing that, Minister. And equally, I can't understand why you haven't adopted antigen testing. So, it's fine, it's great that healthcare workers are going to get the booster vaccination. But if you repeat that mistake of putting all the eggs in the basket of vaccination, this is not going to work. And we know that, unfortunately, vaccinations have disappointed. That wasn't known 6 months ago. We accept that fully. But, there are breakthroughs. And we also know at this point that vaccination doesn't help to stop transmission. So in relation to nurses and healthcare workers generally, as well as the booster vaccines, steps have to be taken to ensure that the air in hospitals, many of which are very old buildings, and the air in other healthcare facilities needs to be safe. We need to ensure that infected air is dealt with in hospitals particularly, but in all of the other settings that I've referred to. Minister, I would also ask that you would consider arranging urgent briefings for the opposition in relation to the steps that are going to be taken now. We haven't had a briefing for many, many months. There's hardly been any this year, actually. So I'd appeal to you again to, bring in the opposition spokespersons or party leaders and provide a thorough briefing on where we go from here in relation to the unfolding, very, very dire situation. To get back to the motion, then, I just want to say, repeat the points made by other people in relation to the IMO survey, the kind of findings that were found, the massive impact of COVID, the burnout that was common pre-pandemic is now rampant in so many healthcare settings. ICU nurses in Vincent's report that they're at breaking point due to staff shortages. They're forced to use a baby monitor to watch patients in ICU because there aren't enough staff. Is it any wonder then that such a high proportion of our nurses are saying they intend to go away, to emigrate, to go to systems, to healthcare systems that actually work, where governments are serious about reform? And again, I would say that the long fingering of Sláinte Care is a significant factor in this regard. Nurses and other healthcare workers are waiting for reform that hasn't been delivered, and they will lose confidence further in the Irish healthcare system. Also, in relation to staffing levels, of course, we were promised more staff. Only a fraction of those have been recruited this year. And there is no doubt that nurses feel very unsupported by government. That's something that you know, we will pay a massive price for unless it's addressed as a matter of urgency. And we get to a point where we have safe and adequate staffing levels, because we're very far from that at this point. Nurses deserve better, patients deserve better,
Thank you, Deputy.
and the public deserves better. Thank you.
Thank you very much, Deputy Shortall.